Thank you, Barb, and thanks to the Lehigh Valley Tea Party group for inviting their coalition to speak here tonight. Words mean stuff, you know? The people who run Washington know how powerful words can be, so they make sure to give laws names that make them sound attractive and reasonable. Like the title of the new health care law, the Patient Protection and Affordable Care Act. I mean, who wouldn't support that, right? Protecting patients and making care affordable? The other thing with words, though, is that you can make them tell lies. Big lies. Whoppers. Like the title of the new health care law. What the law actually does is pretty much the opposite of what it says it does. Those who support the law say it will provide better access for patients, improve safety and quality, and lower costs. Better access? No, I'm afraid not. There are no provisions to increase the number of doctors to provide all the free care promised by the bill and the essential benefits that are currently being written by HHS Secretary Kathleen Sebelius. Patients demanding the mandated free benefits they're entitled to will fill doctors' offices, making it extremely difficult for sick patients to get the care they need. Everyone will have to wait longer for appointments and may have to accept appointments with allied health professionals instead of doctors. And 16 to 18 million newly insured will be dumped into Medicaid, which is almost insolvent in most states, which about a third of providers can't afford to accept and whose patients receive notoriously substandard care. In this case, coverage is not care. Improve safety and quality? No, I'm afraid not. Cookbook medicine, which will be instituted by government agencies, will replace the all-important judgment good doctors use to treat their patients as individuals. No two patients are alike, but payment schemes designed to reduce costs will focus on cost effectiveness and best practices. That's important, remember that one. They'll decide what they will and will not pay for based on some kind of patient collective rather than individuals with unique physiologies and diseases. More efficient? From government? Have you checked the cost of a stamp lately? 158 new agencies in the IRS will decide what treatments are worthy of payment. Private practitioners, if they survive the extinction level event known as ObamaCare, will be forced into accountable care organizations in order to get paid at all. Possibly even more important, though, the Patient Protection and Affordable Care Act will extend an unprecedented level of government control over Americans' lives and how we receive our health care. There are those, in fact, who believe that that's what the law was about all along. Some of them might even be right here in this room. The Patient Protection and Affordable Care Act is the antithesis of its name. It will not do any of the things its name implies, and it will cost us trillions of taxpayer dollars to destroy the best health system in the world. It is quite simply a big, big lie. That lie is the reason the Lehigh Valley Coalition for Healthcare Reform exists. It's our mission to educate the public about the law and how it will affect their health and why we must all work to repeal it. You've probably seen our flyer, What You Need to Know About the New Health Care Law. It took 6 months for our committee to summarize the 2,700 pages that one of our nurse members actually read, along with lots of other resources. If you'd like a more in-depth look at how Obamacare will affect the way you get health care, we'd also like to invite you to join us next Wednesday when 2 doctors and 2 nurses will talk about how Obamacare will affect the way you get health care. Details are on your handout. You're all welcome to join the coalition. We're on Meetup and Facebook. Links are provided in your flyer, and there are additional materials at our table and our own Obamacare bumper stickers and handmade jewelry. All the proceeds, of course, benefit our educational programming. Of course, even though the government thinks it's okay to enact health policy based on abstractions and theories, we know that health care is provided by doctors and nurses, and that they understand it better than any policy wonk or legislator with a law degree or an MBA. That's why we've included doctors in every educational event we've held so far, and this is no exception. Dr. George Arangio taught us about how ObamaCare will impact Medicare and the doctor-patient relationship at our forum in April, and he was gracious enough to bring his presentation to speak with us tonight. Dr. Arangio, my son Tony's personal favorite orthopedic surgeon, is well known in the Lehigh Valley and national orthopedic community as a physician leader and educator. You can read his full bio in the handout on your chairs. Of course, these days, his very favorite title is the one used by his 11 grandchildren. Please welcome Dr. George Arangio.
There we go. Okay. It's my pleasure to be with you tonight, and I want to thank Dr. Bongiorno and Donna for inviting me. As a young physician 40 years ago, I was told that a physician must be pleasant, available whenever his patients called, and affordable. Affable, available, and affordable. And I would add today, valuable. This evening, I'll try to review the 2010 healthcare law and how it affects the physician-patient bond, how it affects the patient access and physician availability. We will review how the law affects affordability of healthcare. Finally, we will look at some best practice changes, which I think might improve healthcare in the future. Next slide, please. The foundation of healthcare is the patient and the physician. They form a unique bond. This bond is personal, confidential, and trustful relationship. The bond between patient and family physician is still the strongest and the most trusting relationship outside the family. You know, years ago, when a doctor would come to my house, my grandmother would put a pillow down, you know, on a chair. I mean, he ranked right under the priest. And things have changed. In return, the patient trusts the physician and agrees to cooperate. For this service, the patient pays a fee. Has the bond and this relationship changed in the last 50 years? Yes, it has. Next slide, please. Government and medicine. In 1960, and really about 1964 is when it all got put together, the government entered into the inner circle of the patient-physician relationship and has escalated this involvement ever since. Medicare and Medicaid subsidizes patients, physicians, and states, and the federal government has made us dependent on federal money. The federal government has elevated, and I would say unsustainably so, the expectations of doctors, patients, and the states. Next slide. Now this is a very important slide. If you want to just know about how the federal government handles business, just take a look at that. This is the history of basically Medicare. Notice the columns in black. As you can see, there has been a significant growth in the expenses over 50 years. It actually compounds at 9% per year. President Obama in Congress has enacted the 2010 Affordable Health Care Act. The goals of this act is to add 17 million uninsured and basically healthy people to Medicaid, and then subsidize another 18 million people who are considered low income. In 2018, Medicare and Medicaid is projected to cost $1.4 trillion. It started out at 9. In 1990, it was 174. 9 times what President Johnson said it would cost. Just 9 times underestimated. This is typical of the federal government, just like the first slide you put up about they're always wrong. Yeah, they're always wrong. The federal government will add $1 trillion of expenses over 10 years because of this law. The national health care expenditure may exceed $4 trillion, or 22%. That is 22% of the gross national product. These are large and unsustainable numbers, and some predict the system will implode on 2024. Just like Social Security is going to implode, this system's going to implode. There's no question if we don't change it. Next slide. Government is involved with the patient-physician bond, but it's not the government. It's your physician that's committed to your good health, and it's your physician, not the government, that has the final moral and legal responsibility for your life and for your death. What do I mean by that? That means we are legally and morally responsible. It doesn't matter what the government says. It doesn't matter what we're told to do. It doesn't matter what any hospital network tells you to do by contract. If things go badly, it's not the hospital. It's not the hospital's responsibility. It should be the physician's responsibility. So to the degree that physicians allow that to happen to themselves, they're making a big mistake. And your patients, U.S. patients, are making a big mistake if you allow that to happen. It's a heavy responsibility. And I can tell you, physicians have been very negatively affected by what's happened in medicine in the last few years. And this law just made it just absolutely almost unbearable for a lot of people. You know, I retired 2 years ago. I can't say that I retired because of this law, but it didn't help me. Okay? So, next slide. Statistics from the Congressional Budget Office estimate that the act will add $100 billion to health care expenses every year. $100 billion. By the way, that might be an underestimate. These are numbers, and I've spent about 35 hours collecting this stuff on the internet, wherever I can find it. It's not easy to find the information. I would say that's even an underestimate. But in any case, it's going to be affordable? Well, $100 billion a year, you judge that. Expenses have already escalated 20% in California. Now, California is not a great state to use as an example. But, you know, even if it's 10%, you know, in Pennsylvania, I don't know the numbers for every state, but I know in California that's happened already. And since the act was passed, has your insurance, whose insurance premiums have gone up in the office? Mine have gone up about 10%. Why? Because the insurance companies, they're not stupid. They know it's going to cost them more to give this care. They're going to jack your, they're going to, I mean, they're business people. They try to operate in a free market. So insurance, they're going to go up higher. There's no way you can do this without costing more. Next slide. Now, this is a little touchy because, frankly, I believe that doctors are responsible for health care. Whether they are and they aren't, and they allow themselves to be manipulated, they are responsible for health care. And does America have valuable health care? Well, value is, this is a new number, this is a new thing for doctors. It's not a new thing for business people. Business people know that you produce a product, somebody's got to pay for the product. It doesn't matter what it costs. You produce a bad product, for too high a price, you go broke. Not in government, and not in medicine. Medicine was a monopoly, it's now a business. Okay? Doctors didn't know the difference years ago. They know now. And unfortunately, they're a little bit behind the 8 ball right now. They're trying to catch up, but we'll see. So what is value? It's defined as best evidence-based care, best results, best patient satisfaction, divided by what it costs to provide that care. Using that definition, not only don't we have the best care in the world, we don't have valuable health care because our health care is expensive. Next slide. In the United States of America, this is a fact that's hard to believe. 5% of the population uses about $90,000 per year, which equals about 50% of health care. That is a true number. These are chronically ill, sick people. 45% of the population use about $9,000 per person per year, or 45% of the healthcare dollar. That's the number you hear all the time, okay? 50% of people, 50, that's like 100, what's that, 175 million, how many people? Something like that. Use 5% of healthcare. That's all the young, all the working people who maybe don't want insurance. My son didn't have insurance until he got married. He was 25 years old. He's a fitness trainer. He didn't need insurance. And when he bought insurance, he bought a $5,000 deductible, inexpensive policy. I don't blame him. Next slide. The 2010 healthcare law adds or subsidizes 35 million poor and healthy people. The law created the Independent Payment Advisory Board and created 32 accountable care organizations. I don't want to explain what that is, but that's basically a bunch of large medical corporations that have been sort of sucked in by the federal government with seed money to provide care for about 26 to 36,000 people in a geographically defined region. Next slide. And of course the Pennsylvania or the state insurance exchanges. Another way, they must have these to implement this law. And whether the Governor Corbett says that's why he's doing it or what, the reason is because they're being lured, in our case, by $38 million to be in the system so that they can sort of make this thing work, because without them they can't work. Next, the individual mandate forces 17 million young, healthy, uninsured citizens to buy insurance they wouldn't normally buy. These young, healthy people use about $900 a year, but it's going to cost them $5,000 a year for insurance. And they're going to be forced to do it. The success of the law lives and dies by these 17 million young, working poor, basically. 18 million poor would receive Medicaid subsidies through the state insurance exchanges. The law of financial success is heavily dependent on the states to sell the program to all their citizens, including privately held insurances. This is another government, manipulation. The law mandates more care, more expenses to a financially stressed healthcare system. Next slide. The law creates the Independent Payment Advisory Board. The IPAB is a 15-member government agency that gets paid about $165,000 a year. It's appointed by the president. It gives inordinate power to the executive branch with almost no control by Congress. Thank God, the House just passed a bill which is against this. And it goes now on to the Senate. But you know what happens when things get to the Senate. So this is not over yet for the IPAB. The Health Care Act adds 35 million enrollees to, this act adds 35 million enrollees to Medicare and Medicaid by 2021. Another 30 million citizens, senior citizens, are going to be added to Medicare during that same period. That's 65 million people more to care for. Not one word in there how the more doctors are going to be trained, how you're going to get the healthcare people to do this. What's it going to do to accessibility? Well, I can tell you, it's not going to make healthcare more accessible. Next slide. The law will modify physician payment. Now listen to this. And those physicians who provide patient satisfaction for less money will receive bonuses. Great system, huh? I mean, doctors are great people, but, sometimes you get lured into doing things you shouldn't do. The 2010 Patient Protection and Affordable Care Act will not protect the patient, and it will decrease patient access and make physicians less available for patient care. The system does not have the manpower to do what the Act requires. Most politicians have not read the Act, and they certainly don't know the manpower impact of the law. glad my wife numbered these pages. Next slide.
She's very efficient.
In the end, patients will determine who are the valuable physicians.
Do you want this one?
Yeah, okay. In the end, patients will determine who are the valuable physicians, hospitals, and insurance companies. Next slide. The patient's going to determine where he's going to go. You're going to determine where you're going to go. You didn't have a choice before. When I came into town, I got the patients from my doctor referrals. Patients, they couldn't remember what I told them 2 minutes when I left the office. I mean, the relationship was a scary relationship. You're much more intelligent today. You're much more aware. And you're going to make the judgment. Just like you make the judgment to go to Walmart versus Giant, you're going to make the judgment. And as soon as the government realizes this, as soon as doctors really realize this, we'll be encouraged to do the correct thing. Next slide. Is the Affordable Care Act affordable? Well, you make the choice. Competitive bidding, Medicare, Advantage cuts, that decreased payments to physicians and pharmaceuticals are projected to save $10 billion this year. That sounds like a lot of money, doesn't it? It's 1.7% of the Medicare budget. The CBO itself called this budget dust. It's a joke. It's a joke. Next slide. The Affordable Health Care Act will cost more than $1,400 billion. That is $1.4 trillion over 10 years. Politicians do not know the financial impact of the law, and if they do, they should be ashamed of themselves. Next, who will pay the $1.4 trillion? Well, ultimately, you will. But the young, in this law, the young, healthy, working poor who choose to forego coverage, and rightly so in some cases, they're going to pay. Small businesses are going to pay. Frankly, a lot of small businesses are prepared to pay the $2,000 penalty. It's cheaper, and they're doing it already. That's how really foolish the government is. I mean, they weren't smart enough to realize if they're going to do the calculations, they're going to pay, should have made the penalty $10,000, you know, if they were really smart. But they're not even smart when they should be smart. Many are paying the penalty, and the enrolling numbers are much lower than the government projected, and they're really worried because they need these 17 million people, and they need the small businesses to pay, you know, to not to pay the penalty, but to get people into the program, or else the program won't run. Senior citizens are seeing costs go up, co-pays go up, and there's a chance that $300 billion will be shifted from Social Security and Medicare into other insurance programs because of shortfalls. Of course, the payer of last resort is the taxpayer. Next slide. Now, this is a beautiful, I wish you could put the lights down just a little bit. This is, my folks are from Sicily, but this is Mount Etna. I mean, this is, somebody took a picture of this from Taormina. Now, I've been on Taormina, I've seen this. I've never seen this beautiful. But this is a beautiful picture. But I show it because I say here, is the 2010 Health Care Act a good and benign law or a bad and dangerous law? It's sort of like a volcano, isn't it? Well, you're going to decide come November, and I hope the Supreme Court will help us out here. Next slide. No, that's keep that slide. Is the experts report that there's too much health care in the United States, and experts report that patients and physicians overuse health services. Experts claim that there is waste and duplication of services and inefficiency in our healthcare system. And some people, namely that gentleman there and Mary Hitchcock at Dartmouth, would say that there's about 25 to 30% waste in the system. Now, I'd like to stand here and tell you none of those things are true, but they are. They really are. And you know people in your families that have used the emergency room when they shouldn't have, have had doctor calls and care when they really didn't have, and your grandmother would smack you across the head if you should choose, a physician, go to the doctor for those kinds of things. So, next slide, please. This is what business could do. That adds up, next slide, to $140 billion of savings a year if this was a free market system. Next slide. This is the comparison of what we have and what we could have, okay? And it's our choice. It's our choice. We could have $1.4 trillion of loss, of costs, and $460 billion of basically profits. Now, will it go in your pocket? Not really. It will, because you won't have to pay taxes and stuff. It'll go into insurance pockets and other places. And of course, if you are smart, you'll buy insurance companies, and then you'll get the dividends and you'll get the benefit that way. But that's the way capitalism works, okay? So you can have it one or the other way. Well, we know who's going to do this. But who's going to do this? Next slide, please. I have to tell you that the Supreme Court has the wisdom and the power to completely knock this law out of the park, and they should. Will they? I'm not sure. I'm going to really quickly go through this, but you could fix this whole thing, and doctors have to do it. Nobody knows medicine better than us, and we're smarter than we were 20 years ago. We know how to do this. And unfortunately, too many of us are employed by the government, by hospital systems, and believe me, I bet Donna will not like to hear this. The day of the single practice physician is over. It's never going to go back. Never. The only thing we hope for is that this larger groups and larger groups will get smarter and they'll do this. And what this tells us is basically that we need insurance that is 100% coverage for unavoidable, unplanned problems. That's what insurance is for. It's not for elective surgery. It's not for, hair implants. And I mean, if you want that stuff, you should pay for it out of your pocket. There's about $500 billion of that a year being done, being paid by Medicare. Now, $500 billion, multiply that by 10 years. Think what you could do with that money. There's waste in the system. Doctors can fix this. Insurance companies will fix it, and they should. Okay? So, the insurance should be 100%. It should cover preconditions. What the heck? I mean, if you got cancer, why shouldn't you be insured? That's what the insurance is for God's sake. And senior citizens. If you make $200,000 a year and you're retired, maybe you should pay something in your Medicare. I mean, maybe you should. Maybe you should pay 20%. I mean, that's what you would do if you had car insurance. So I think there is a way to do this, and it can happen. Next slide, please.
You want that one or that one?
This one. Why doesn't it exist? Because government prevents it. They basically have conned us into it. They've given us a lot of money, and they basically prevent this. Next slide. What are physicians doing? I mean, physicians are working on this. I mean, you can read that, okay? I'll leave it up there long enough. I mean, we're measuring, we're learning, we're collecting data. Who do you think is collecting this data? You think that administrators can collect data on healthcare? Your doctors with MBAs might be doing it, but it's physicians, believe me. And they're using the most valuable and expensive hospital information systems. Next slide. And you know what the goal is? I read this, and I couldn't believe I was reading this. This is from, not Medicare, they're striving for perfect care every time. It's like when you fly an airplane. Do you want to get in an airplane that might land safely? Do you want your doctor to treat you and he might get through the operation? Well, that's basically the way it is. I mean, it's the art of medicine. They're trying to get perfect care for everybody. Okay? And it can happen. I mean, we can't get rid of all complications, but we certainly can do better than we've been doing. Next, please. Patients want quality care for less money. That's what you want, don't you? You want to go to the doctor, know you're going to get the best care, and you're not going to get screwed. Okay? You don't trust anybody anymore. You know, I had a guy ask me at the last meeting, why don't the doctors have their prices up on the wall? Well, I don't know if it'll ever get to that, and I don't know that I want to go to an office like that. But, you know, you should have fairly consistent prices from region to region and state to state. You shouldn't have, you know, 55,000 more back operations in New England than you have in Pennsylvania. Next, in the future, more physicians and nurses, and that's key, more physicians, more nurses, more healthcare delivery will lead to more competition. And doctors don't like to hear that. Nobody likes to hear that. But it's going to happen. And when you have more competition with less government, believe me, prices will come down. And it hasn't happened in medicine because we don't have that situation today. We still have too few doctors. As long as you have too few doctors and increasing demand, supply and demand, prices goes up. So, next, who will determine the value of medicine? Physicians are going to determine this. We have the pen. There isn't anything that happens in medicine that a doctor doesn't write for. Who will choose? The patients will choose. They'll decide. Next, please. George Washington said it best in his farewell address to the people of the United States in 1796. It said, government is not reason, it is force, a fearful master. Never for a moment should it be left to irresponsible action, there being constant danger of excess. I think we've had some excess here, to talk about the cliff. The effort ought to be by force of public opinion, which is what we're doing here tonight. It's what the Tea Party is all about, and the Coalition for Healthcare, to mitigate and lessen it. Thank you.
Thank you, Dr. Arangio. Please feel free to quote Dr. Arangio the next time someone says to you, but if we repeal the health care law, it'll destroy Medicare as we know it. Because the health care law did destroy Medicare as we know it. Dr. Arangio's right. Doctors and nurses and patients can make the difference, but only if we all stay involved and engaged over the next several months. In addition to Dr. Arangio's expertise, we'd like to share a short video with you featuring another national physician leader. Dr. Jill Vecchio is a Colorado radiologist and president of the Colorado chapter of the physician advocacy group Docs for Patient Care. She's created a 7-part series, the first part of which we're going to share with you tonight. Paul? Isn't she marvelous? The other 6 videos are just as informative, just as easy to watch. There are links in your handouts, but honestly, all you need to do is go to YouTube and type in Jill Vecchio, and you'll be able to find them. They're well worth the time. So our next speaker, Dr. Christine Bongiorno, doesn't really need an introduction to this group, but I'd like to share a few things about her that you might not know. She just turned 40. Is anybody that young? Second, she likes cats. Oh, wait a minute, you probably already knew that, huh? Okay, anyway. Dr. Bongiorno's patients can't tell her where it hurts, but she figures it out anyway. Hopefully, she'll be opening her own local veterinary practice this year. In the meantime, she's making a lot of noise about America's freedoms as chair of the Lehigh Valley Coalition for Healthcare Reform and a member of the executive board of this Tea Party group. You can read more about Dr. Christine in your handout. Please welcome Dr. Christine Bongiorno, who's going to talk to us about how ObamaCare affects businesses and the economy.
I'm getting used to the 40 thing now, so I'm pretty good. A few months ago, at the Pennsylvania Leadership Conference in Harrisburg, a reporter from a local newspaper, who will go unnamed, asked me why I cared so much about Obamacare. Since as a veterinarian, my patients would not be affected by this bill. Besides pointing out the obvious fact that we will all be patients and in need of health care someday, if not now, I also told him that this bill is about much more than health care and affects nearly every aspect of life in America, notably businesses and thus the economy. He wasn't interested in learning more, preferring to focus on the fact that we were selling jewelry, which you can find, by the way, on sale at the back table. So why do I care? Why do I care? Well, I've been a patient. I have received excellent care from my doctors over the years because we do have the best health care in the world, and I want to keep it that way. Notice I said care, not insurance. Those are two different things. Why should you care? Well, other than needing a doctor at some point in your life. Because you will be an employee or an employer, or maybe both, during your lifetime. Currently, I'm an employee, but I'm in the process, as Donna said, of starting my own veterinary practice. As a veterinarian, anything that affects small businesses and the economy is a huge concern to me. It affects everything I do and can do for my patients and my employees. The care purchased for my patients depends on how much disposable income their owners have. That's just an example for my business. But think of how it affects all other small businesses, from the local cupcake bakery to the bigger chain stores. I, like many people my age, grew up believing that healthcare should and would be provided by your job. A good job included full health insurance for you and often your dependents. I didn't know the history behind this entitlement that so many Americans still cling to. It was started in the 40s with President FDR, wage and price controls that were used to help finance the war. So businesses needed something to compete to attract workers, and they started offering health benefits. Ultimately, they became tax-exempt benefits, and they ultimately resulted in this formalized third-party payer system that we have. These systems always result in rationing because, as the previous speaker said, no one can afford to pay for everything for everyone and yet remain solvent. Well, Obamacare only promotes this system, which results in lower quality and less quantity for higher costs. I think many people believe that Obamacare ensures that they will be insured. They believe their employers will be forced to offer insurance and that they will not lose their doctors as promised. This is not the case. Approximately 80% of businesses will have to change plans because it's far too easy to lose the so-called grandfathered plans. By the way, they're still yet to be decided upon, and I don't know who that would be deciding that. 4 ways that small businesses will be negatively impacted are higher health care costs, ineffective small business tax credits, higher regulation compliance costs, and Medicare taxes and other taxes. Starting in 2014, a company with 50 or more full-time employees will be fined if they don't provide health insurance. These employees can enroll in a qualified, again, to be determined by Kathleen Sebella's plan. If they do, the company can still be fined even if one person receives federal assistance, and that's could be up to $40,000, for example, for a company that's just with 50 employees. These rules and regulations affect companies that hire lower income workers, who are more often than not non-white, high school dropouts, and women. The CBO estimates that by 2016, the cost of an employer-sponsored plan covering 70% of health expenses will be $15,200 a family. These regulations make it much more attractive, of course, think about this, to hire more part-time employees, not grow beyond this magical number of 49. They will also be less likely they were going to pay you less money, avoid sick individuals, and limit or decrease other benefits that we could potentially offer, as well as having the current employees just take on more hours. Some companies will just use independent contractors or export jobs overseas, and actually many small firms will simply be crushed and fail. There was supposed to be a benefit to small businesses in the form of tax credits, but it was for smaller firms that offered lower wages, and it was only from 2010 to 2013. The tax credits went down as the company size and average salary increased. In 2010, only 170,000 out of as many as 4 million potential businesses, or just 4%, claimed these credits. Why? The paperwork and steps necessary to even get these credits are considered by most companies to be far too complex and time-consuming, which often translates into dollars for a small business, either in their time or hiring an accountant. There's also a new payroll tax on investments scheduled to start next year. Middle-class people would be subject to this even if they were rich for a day. For example, the day they bought and sold a house in the same day. What does this have to do with improving health care? I don't know either. Other tax hikes include an increase on the Medicare hospital portion of the payroll tax, which affects both employees in your paychecks and employers in what they have to pay out for each employee. There's also a tax on what they call flow-through income, which basically just takes away money from the business that could be reinvested and gives it to the government, who of course can spend it better, right? Another tax that affects both our healthcare and the business sector involves a 2.3% tax on the sale of what they call Class 1 or durable medical devices. This discourages companies from innovating and creating medical products in this country. As an example, a Michigan-based medical device company, Stryker, who makes hip and knee replacements, has already planned a series of layoffs. This tax is expected to cut R&D spending by $2 billion. This is anything but economic stimulus or healthcare. This bill hits people in the wallets from both ends. Employers will have less to spend on their businesses and their employees' wages, and employees, who are also consumers, will have less to spend on businesses, if they can find a job at all. Anyone see where this is going? You don't need an economics degree to get that this is a formula for disaster, not growth of the private sector in this country. Why would anyone want to start a business? And the advice from those with sound economic knowledge is to simply not offer health insurance at all, if you haven't already. Honestly, this is something I'm not even sure what I'm going to do yet at this point. I have to look at the numbers too. If you do, they recommend dropping it by 2014. As employers, we don't pay for your auto or home insurance, so why should we pay for your health insurance? What if we allow people to buy insurance with tax-free dollars? If health insurance was portable, employers wouldn't have that hold over their employees either. And businesses could put all the money they spend on employee health insurance back into the business in the form of equipment, marketing, and more employees, etc. There are a lot more details and so much more that I could say on this. When I did this research, the more I looked into it, honestly, it scared me. Like, it was just like, if you just look at this aspect of it, you wouldn't want this bill. Forget about the healthcare aspects, which are already horrible. So if anybody has any questions or info, I can give you a lot more details and numbers. It's not good. Thank you.
Thank you, Christine. Now I'm scared. We're going to skip the second video, but I would very much recommend that you use the link on your handout and check out ObamaCare and the Road to Serfdom when you're sitting in front of your own computer at some point. It's very worth the time. The next 6 months are critical to America's health and freedom. Those who only want the government to take care of them will, unfortunately, in November, vote to keep all of their goodies. Those of us who want to make our own choices and take care of ourselves must educate our friends, family, and neighbors, and support candidates who promise to repeal Obamacare. Please get involved and stay involved. Your health and freedom depend upon it. Now I'm going to turn the program over to Ginny Tabor and the members of the Individual Rights Committee. We've told you how Obamacare impacts the economy and your health. They're going to tell you how it violates your rights as an American.
Sorry, I have to get this arranged or I won't be able to handle all these papers. Can everybody hear me? Okay, you just heard many of the frightening details about Obamacare. This presentation will present the moral case against Obamacare. By moral, I mean the proper relationship between an individual and his government, namely an individual's unalienable individual rights. Now, individual rights health care is not a right. And I'm going to give another quote from George Washington. He's very popular tonight. Government is not reason, it's not eloquence, it is force. And force, like fire, is a dangerous servant and a fearful master. End of quote. Now, George Washington properly identified the government as pure force. Given this fact, the problem the Founding Fathers had to solve was, how can we establish a government where an individual can be free to exercise his unalienable rights? Next slide. Now, this is on unalienable rights. Now, I guess a lot of you didn't see the video that was being shown as you were entering the room, but many of you may have seen it at some other place. It was done by the Free Market America, and it was titled, "If I Wanted America to Fail." How many of you saw that? It's a really brilliant video. Well, I'm here to remind you that the fundamental reason for America's success is the recognition of man's unalienable individual rights. For the first time in history, in the history of mankind, the role of government was reversed from master owner of man to man's servant protector. So what went wrong? What went wrong was the gradual loss of the meaning of individual rights. When was the last time you heard a public figure even mention individual rights? Do you understand at a gut level just what individual rights are? When you support certain legislation, do you know whether or not it will violate someone's individual rights? Next slide.
Just the one you want first.
Oh, how did that get there? Okay. Now, if I wanted America to fail, I would change the meaning of individual rights gradually. How? By introducing counterfeit rights into the culture. What do I mean? By introducing rights to things like a job, a living wage, a decent home, adequate health care, a good education, old age security, a minimum wage, food stamps, cell phones. Now, these are all economic rights. So what's wrong with that? Well, who's going to pay for them? Don't the payers have rights? Think about it. Everything man needs for his survival and happiness must be produced by someone. Next slide. There are no economic rights. There are no rights to free things or free services. There is just the freedom to think and act, to acquire them yourself. There is no right to a free lunch. There is no right to enslave. George Washington was right that the government is force, but now government is using its force to violate our individual rights. Next slide. Here's another counterfeit right: political correctness. A person has no right to be protected from hurt feelings. Feelings are not tools of cognition. They vary from person to person. They are completely subjective and difficult to know in advance. The only way to comply is not to speak at all. So truth vanishes from the public conversation, and so does freedom of speech. Next slide. Another counterfeit right is group rights. Rights apply only to an individual person. A group of people can have no rights different from the individual rights of each member. There are no women's rights, black rights, workers' rights, farmers' rights, welfare rights, etc. There is only your individual right to your own life and your freedom to act, to sustain, and enjoy it. So why have so many groups formed to demand special rights? Is it their conscious or subconscious recognition that government is force? It certainly is to their advantage to persuade the government to pass laws which provide them with special treatment. Some call this crony capitalism when businessmen do it. Next slide. What do the unalienable rights of life, liberty, property, and the pursuit of happiness really mean? It means you own your life. You don't belong to the government. It means you own the products you produce and purchase. It means you are free to take any actions necessary to sustain and enjoy your life, provided they don't violate the rights of others. It means your rights can't be taken away by a majority vote. The right to property means the right to act, to acquire, to use, to keep, and to dispose of material values. A right defines a man's freedom to act when living in a society. Please remember two things. One, you are your most important property. Two, rights are the freedom to take actions, not the rights to receive things. Next slide. To use his individual rights, man needs the freedom to use his mind, which is his tool of survival, to think in order to produce the things he needs for his survival. Set long-range goals. Have a moral code to guide his choices. Trade his goods or services without interference. earn self-esteem, which results in happiness. Man must act without violating the rights of other people. In other words, man needs to live in a society which respects and protects his freedom to think and act for his own survival and happiness. A society in which all contracts are voluntary, namely free enterprise. Next slide.
Oh. He did it. Is that you? Sorry.
What violates individual rights? The initiation of force or fraud against a person. Any law or executive order which forces a person to act against his own rational judgment. Any law or executive order which violates property rights. Any law or executive order which violates the Bill of Rights or the 13th Amendment or Section 1 of the 14th Amendment. Remember, man's main distinction from the rest of the animal kingdom is his mind. Man must learn how to think, then choose to think, then choose to act. Man's tool of survival is his mind, not his physical strength. Only the initiation of physical force can prevent a man from acting on his best judgment. Both criminals and the government are his potential enemies. Now, next slide. How are rights protected? The only legitimate purpose of government is to protect us from the initiation of force or fraud. Now, how does the government do this? The police protect us from criminals. The armed forces protect us from foreign threats. The courts try and punish criminals. The courts settle civil suits peacefully by using objective laws. Period. Let's hope that the Supreme Court will protect us from ObamaCare. It violates the individual rights of almost every individual in the country. Next slide. ObamaCare violates all individual rights. It treats neither patients, nor doctors, nor health care providers, nor business people as individual human beings, but as serfs to be ordered around. The young and old are expendable. The good of the collective trumps the rights of the individual. Freedom to choose is not an option. If you want America to succeed, hello freedom, bye-bye ObamaCare. I have just a few more remarks. The problem the Founding Fathers attempted to solve, namely, how can we establish a government where an individual can be free to exercise his unalienable rights? Their solution was successful for a while. It produced the most productive, innovative wealthy, happy country in the history of mankind. The gradual loss of individual rights from the late 19th century and the 20th century has accelerated drastically in the 21st century. Many new philosophical ideas have corrupted the ideas of the Founding Fathers and have caused the destruction of the greatest country in man's history. So those of us who embrace individual rights as our birthright must fight to restore them. Today, many people no longer know what individual rights are. We must understand individual rights not as floating abstractions or automatically recited slogans, but in the deepest areas of our minds and bodies. Only then will we have the emotional energy necessary to win this battle to restore our precious rights.
Kind of cool in here. I went and got my jacket. Okay, now Mike Sazuli has a presentation about immigration. Where's Mike? Oh, there he is. Okay, and he's going to tie it into Obamacare too. So this affects all areas of our lives, just the medical. Here you go, Mike.
The pen I've been looking for. Well, are we ready?
Which one you want first?
Oh, the first one on the list.
I don't have the list. Which one do you want first?
Testimony of illegal alien care?
Okay, the next short video we have on anchor babies. Anchor babies is big we have people coming across our border, having children, coming across our border 8 months pregnant, and they come across just to have their babies here. And once they're here, they're considered, I guess, by some to be American citizens, and then therefore that, well, you'll see in the video. You ready?
Just last year, lawmakers proposed more than
The question is, who pays for these services? I think inevitably we do, with higher hospital costs and insurance rates. And now I do feel the concern and compassion, but to what extent does our good nature, how long can we get taken advantage of like this? Thank you.
Okay, that's our presentation about Obamacare. So I'd like to have the presenters come sit up here at the tables, if you would, and if there's any questions that you have for any of them, they'll be glad to take your questions. Okay.
Hey, I have a question.
Okay,
It's for Donna.
for Donna.
Governor Corbett signed or implemented the insurance exchange, right? Is that a done deal now?
No, it's not a done deal.
What can we? I guess this is another thing I think that we should be actively involved in, because, as I understand it, the federal government is dangling money in front of him. He wants to take
The state of Pennsylvania has accepted, Governor Rendell applied for an initial grant to do a feasibility study in Pennsylvania as to whether or not Pennsylvania, the bottom line is, if Obamacare stands, there will be a health care exchange in Pennsylvania. The issue that we're looking at right now, and that a lot of people have gotten very active about recently, is whether or not
Pennsylvania will run its own exchange or whether the federal government will run the exchange. The insurance policies which can be offered through the exchange must be approved by the Secretary of Health and Human Services, whether it's a state-run exchange or a federal exchange. So an initial grant was accepted, and a study was done last summer. I think it was a $3 million study that prompted the governor to decide that if we have to have an exchange, that it would be better for Pennsylvania if Pennsylvania ran the exchange. And because of that belief, they have accepted an additional $34 billion from the federal government to implement an exchange in Pennsylvania. However, none of that has happened and will not happen until after the Supreme Court rules and after the election in November. So while the state of Pennsylvania has accepted federal money and is prepared to implement an exchange, should we discover that Obamacare really is, God forbid, the law of the land, that they will then have legislation in place to go ahead and make that happen. But it's not a done deal. In fact, a group of physicians and people from several grassroots organizations just had a meeting last week with the governor's deputy secretary or deputy chief of staff about the exchanges, and with the head of the insurance department, who actually spoke at the coalition's exchange debate in February. And they have been assured that no action will be taken by the state of Pennsylvania until after the Supreme Court rules and after the election in November. And hopefully the whole discussion will become a moot one. What happens to that $34 billion, I don't think anyone has a clue about that. But it's not a done deal yet. If you want to, call the governor's office and say we don't want a Pennsylvania-based exchange, please feel free to do that. But it's not something that I personally believe that we need to be really, really worried about right this minute, because there's a whole lot of other stuff that is much more important right now.
Great answer, thank you.
I have a letter in my hand from the governor about the insurance, about the exchange. It was just handed to me a while ago. So what I think we'll do is we'll put this on the website, and that way everybody can see it and read it. It just was handed to me. So, and he talks about having Pennsylvania do things instead of Washington D.C. So we'll put it on the website. Okay?
So much more trustworthy.
Yeah, right.
That's what people see. Exactly.
Okay, Michael?
Hi, yeah. I just want to point out that during the answer to that question, I did a little math in my head. One of the slides that we saw tonight said that it was estimated that Obamacare would add about $1.5 trillion to our health care costs. Well, 34 billion times 50 is 1.7 trillion. So if every state does that, well, we're already beyond that estimate. Just want to point that out.
Good point. Their numbers are always wrong.
Yeah. Bob?
I run into a lot of young construction workers, and I'm trying to convince them they think they're going to get free insurance when you stand up. From what I heard tonight, young people think they're going to get a free insurance ride. And from what I heard tonight, in 2014, it looks like the penalty will only be $95 a year, but they'll still get insurance. And then in 16, they'll get $700 a year penalty.
Well, it's $700 a year, or I believe it's 2.5% of your income, whichever is highest.
Okay.
So
There's got to
most
be a
people-
point where it exceeds the cost of the insurance, the penalty, to force them to buy the insurance.
Well, that's not written in the law.
So in other words, low-income people, it would be cheaper for them just to keep paying the penalty, and they'll get their insurance.
And we'll keep paying.
Yeah, well,
Yes, ma'am.
I had a question. It was really for the doctor, but whoever can answer it. When was it the federal or the state governments that initially said that you couldn't turn anybody away at the emergency care. What year was that?
I believe it was in the late 80s.
Bill,
do you know? Do you know what year?
That was part of the Medicare law. In order for hospitals to accept payment from Medicare, they couldn't turn anybody.
In the 1980s. Okay, and then
Medicare was passed in 65.
And then Medicaid, when did that start?
64, right, with the Lyndon Johnson War on Poverty. 64 was both Medicare and Medicaid.
Okay, so that they forced them to not turn people away, and then they had to pay for it.
Well, they didn't care about paying for it. They just said you couldn't turn anyone away.
They got that wrong too, huh?
They got it now where your kid graduates from college, can't find a job, comes and lives with you. You can put him on your insurance. No, you have to put him on your insurance because he can't afford to buy any. They're gonna make you pay for it. One way or the other.
Yeah, up to 26. They can stay on the insurance until they're 26.
Right.
I object that they can't afford it, because my daughter, when she finished Penn State, she got her own insurance. It was $186 a month, and it was good coverage. She's young, her insurance cost wasn't bad. And $186 a month, I know it's tough times and tight, but that's not too much money for insurance. Well, I'm just saying, but she, no, it was a $250 deductible. It was actually very good.
But it was only available for 6 months.
No, she had it for 4 years.
Really?
3 years.
What?
It was through, Aetna. It was a major insurance company.
But like, those policies will not be available in Vermont.
But there was no limit. I don't know how long she kept it for that. Several years.
Tim?
The individual rights in healthcare is not a right. I thought that was absolutely brilliant. Thank you. And could that be put like up on the PowerPoint? Could it be put up on the website so that we could access it?
Yes, so we can email it.
It was that good.
Yeah. Yes.
Okay. Glenn?
Two quick things. Again, back to Ginny. I thought that presentation was very good. You don't hear about these individual rights.
Yes.
And it's very easy to understand, and it all falls into place when you hear it like that. So it's a pipe dream, but I would love if kids in grade school and middle school would be taught individual rights. And the other comment, and correct me if I'm wrong, as far as anybody born in this country is automatically a citizen, did that not start with actually good intentions back after the Civil War to protect the former slaves? So
Yeah, I don't think anybody conceived of
and there's no real connection anymore, but they now are taking care of that.
Any other questions? Questions? Mike?
The penalty money that you're talking about, who gets the penalty?
federal government.
Federal government, so it's kind of like a scam, the government gets, they take that money.
It's
put it
not
back
a
into
tax though. Well, in one argument to the Supreme Court, it's a tax. But in the other argument to the Supreme Court, it was a fee.
I understand, I get that, but does the government intend to take that and put it back into the healthcare program, or they just going to take that and run off with it?
Actually, they are actually counting penalties that will be paid to them as part of the revenues to drive the other programs in Obamacare. So they're already counting that money.
Counting on that money.
Right, they're counting on the money from the people who aren't going to buy the insurance.
And they've already hired 4,000 IRS agents, but it's not a tax.
16,000.
Oh, okay, 16,000. Well, they hired a few more since I read. Yes, sir.
To the individual rights committee there, if individual rights are not like voted on by people, what determines them? Who determines them?
Unalienable, God-given individual rights. That's what it's in the Constitution. Where else could rights come from?
I can answer that. Where else rights can come from is the nature of man. Man cannot exist unless he has freedom of action to survive, as this presentation showed. And so you need to have the freedom of action to take actions to survive. No society could ever keep on living unless you had that right to take those actions that give you the freedom to speak, the freedom to assemble, the right to practice your own religion your own way, the right to bear arms, to fight against tyranny, and so on. So they are an actual natural requirement for the existence of man. And that's what the Founding Fathers were recognizing. So there's two different places where rights can come from. The religious people believe that they come from God and are handed down. And other people in the founding of the country said they are the natural result of the nature of man and the necessary use of his mind to survive. It doesn't matter which source they come from, you have to fight to preserve them. That's the beauty of this country. That's what made this country unique and exceptional in the world. And we can stand side by side, both systems can stand side by side and fight for individual rights because we both need them. There's the other answer.
Yes, ma'am.
Given the penalties and the way they're currently structured, which I firmly believe will change as time goes by, but can't we honestly look at this and say that those penalties are structured in a way to cause the cracks of the insurance system?
Absolutely.
And to accelerate the push towards nationalized insurance?
That's the reason.
And why don't we talk about that directly? Because that has to happen within,
Within a couple of,
it's
well,
not even
look
gonna
at
be
what
5 years.
Dr. Arangio pointed out, what happened in Massachusetts. The 4 major companies had billion-dollar losses, and that simply is not sustainable. Yes, I believe that the health care law was written specifically in order to put private insurance companies out of business so that the government could say, oh, gee, look, there's no companies, there's no choice. We're going to have to create a company to cover everyone. Medicare for all.
If I could follow on to what Donna said, as an ex-refugee from Massachusetts, I go back occasionally, and in the newspapers about a year ago was a major controversy. Insurance companies were moving out of Massachusetts, and the dictator legislatures were arguing, can we enslave these insurance companies and prevent them from leaving a state? They were honest to God talking about doing that a year or two ago. So that's the devolution to tyranny and chaos that these kind of laws generate.
There was another thing that they tried to do in Massachusetts, because as Dr. Arangio also pointed out, that many physicians in Massachusetts are no longer accepting Medicare and Medicaid. So they actually wrote and were prepared to vote upon a bill that would require every doctor in the state of Massachusetts, as a condition of licensure, to accept all of the state and federally run insurance programs, which is basically enslaving the doctors.
Paul?
It's really not a question, it's a statement on illegals. I was in a tax office last week, and an illegal walked in and said, I need my tax returns done for the last 8 years. And he was asked by the preparer, well, do you have documentation on how much you made, etc.? No, I don't have anything. Who's requiring you to do this? The IRS. And why do you have to do that? My lawyer said I have to get these tax returns done or I'm going to be deported. The way the law is now, if an illegal reports his income, he cannot be deported. In order to report your income, you apply for what they call an ITIN number, which is very easy to get. But once they get that, they can work illegally and they cannot be deported. But in this particular case, that office says, I can't do your return because you don't have documentation. But I'm sure he's going to go to another office that will do it.
Yes.
Tom?
I wanted to build on what Donna was saying, that they did a survey in England, and they found out a lot of people in England do not like socialized medicine.
Yeah.
They cannot vote it out because such a large percentage of the population is either working for socialized medicine or earn their living by supporting socialized medicine, so they control the vote. The socialists control the vote, and that, I'm sure, is what they're hoping will happen here.
Yeah, and as people get
That's a
used to it.
danger of having it enforced, we can never get out of it.
And people start liking some of the aspects of it, and then they don't want to get rid of it either. Yes, ma'am.
Yeah, I just want to say two things. One is the fact that one of the states already tried, they're talking about striking down the individual mandate. I just wanted that's going to happen, and Obama's going to have to revise in his second term. That's what he's planning. So really, there's got to be an imperative to get rid of, there will be no second term. Secondly, Kentucky tried to do this state-enforced program without an individual mandate. The insurance premiums started just skyrocketed. It's one of the reasons, like the American or the Association of Health Insurers supported ObamaCare, because actuarially the only way it works is with the individual mandate and the financing of that way. Else it doesn't work. We go to single payer, which I don't think the government's going to take it over. I think they're going to give it to one of the larger insurance companies. I think one of them is already affiliated with a lot of social security programs. I'm really paranoid. I really think that will be more the thrust of it, so it won't be a government program per se. It will be one payer, and it'll be one big payer, and
One
it'll be
big
part
one.
of the current capitalism.
Yeah.
So.
Yes, ma'am.
I just want to make a statement. I had watched on Pennsylvania Cable Network, and this had to do with immigration. And this is why it is so important that we put the right people in our state government. They had the head of the chief of police at Reading. They had somebody, some conservative fellow, I can't remember right now, but they were talking about the illegal immigration. And I watched one of our Pennsylvania representatives sitting in the back saying nothing, and I was getting livid. These cops' hands are tied. They can stop these people that they know something's wrong. They know that there's drugs and everything, and they have a record, and they have a bunch of cards. And they call ICE, and ICE says, let them go. Now, that's this crazy government we have. Another thing is with Planned Parenthood. We are killing so many babies, and now we have the gender site, but then we have hospice, and I did hospice care. And Medicare covers that wonderfully. But it's so sad, all the babies we're killing in this country. And this is why we're reaping all this garbage, because of what's going on in this country. And it just makes you cry.
I know.
And so we have got to put decent people in, and you got to put political parties aside and vote for somebody who has morals and rights. I called that representative up, and I said, why didn't you say something? And she said, she's giving me a whole bunch of fluff, because there were two crazy people in front of her, some goofy guy from Philadelphia and somebody somewhere else, and they did all this silly talking, and it's like hands are tied. And I think we even need to get a hold of our governor, because I don't even know what he was doing. I didn't understand it with him signing on to some of the stuff, Donna, you were talking about with ObamaCare. Maybe we need to hold his feet to the fire. I don't know.
He's been hearing from Pennsylvania.
Well, he needs to
He has
hear.
absolutely been hearing.
Because they all play politics, and it makes you sick.
Yeah. I have one more question, and then we have to cut. Yes, ma'am.
This isn't a question. I just want to tell you something I had some experience with. A close friend of mine was on the playground with a child that she was watching because his mother was working. Kids threw a basketball, hit her on the bridge of the nose. She had sunglasses on, so when it hit her, the sunglasses, the bridge, cut her nose. So she comes home, it's bleeding, she puts it on, she gets home. She says to her husband, look, it actually slit my skin. Well, he said it looks okay, he put some medicine on. He said, we'll put a butterfly Band-Aid on. Oh, she said, I think I have to go to the hospital. I might need stitches. He said, you don't need stitches, I can put it in place. She went to Westfield Hospital. They took adhesive and they glued it, and she was home within 18 minutes of when she left to go to Westfield Hospital. She put it on her Blue Cross and Blue Shield. The bill was $1,100. Blue Cross and Blue Shield paid everything but $400. She got the bill for the $400. Now she's arguing she doesn't want to pay it. Okay. Now we all know that that's an outrageous price.
Right.
But the other thing that bothered me was, what the heck did she go to the hospital for?
Right.
Why did we do this? Why
Because she had insurance.
Because she had insurance.
And that's part of the American problem. We think, oh my God, insurance, so I will go instead of
Okay.
taking care of myself.
Thank you. Okay. I hope you enjoyed all this information tonight about Obamacare.